Good morning. Folks are slowly joining. It's 11:01. We'll give them a little bit longer. Thank you so much for joining us this morning. Good morning. Welcome to the second session of our Cause Solution Camp on housing, shelter, and bed management. This call will be recorded and will be made available after the session. Please post your questions in the chat. Our agenda includes current industry challenges and a brief product overview, an introduction to Provisio partners, a technical demo, and a bit about the Water Street mission. And finally, the reason you're all here, an Ask Me Anything session with a Trailblazer. As a reminder, this session is part of our summer camp enablement and includes one more session next week on early childcare. Please invite your colleagues. Salesforce is a publicly traded company. Customers should make buying decisions only on the products commercially available. I want to start by thanking you all for taking the time to connect and for all of the important work that you do to support your mission, your staff, your constituents every day. I am so inspired by your resiliency and the work that you do in your organizations to keep your community strong and vibrant. I'm Steph. I'm an account executive at Salesforce.org, where I work exclusively with nonprofits. Before joining Salesforce, I worked at New Jersey's largest YMCA in fundraising and in programming. And today we're joined by Valerie Rogers, Senior Solutions Engineer at Provisio. Her professional background includes over 15 years working in affordable housing and economic development. I also have the honor of introducing a true trailblazer, Colleen Adams, Vice President of Programming at Water Street Mission. We can't wait to hear about her work and her organization later in the presentation. In talking with our customers, they've shared how the past couple of years have accelerated challenges that nonprofits were facing prior to the pandemic. Just take a look at these statistics. The way that we work has forever changed. Delivering programs and services to clients has required adjustments, and a majority of nonprofits have changed their size and structure due to the demand of services and delivering programs, with leaders often serving in dual roles, taking on responsibilities that maybe didn't even exist before COVID. They're also finding it difficult to manage growing caseloads while maintaining speed and quality. Nonprofit staffing shortages have also affected all human service organizations. Client expectations are changing, as well as the client experience, because the client experience is the most important as the services that you are providing. So, how can Salesforce help? Whether you're new to Salesforce or an old friend, let's start with introducing Salesforce for Nonprofits. Salesforce.org takes advantage of the core Salesforce platform features to create nonprofit-specific solutions across fundraising, marketing and engagement, program management, grant making, and also drives internal organizational excellence. Salesforce for Nonprofit helps you gain a holistic view of your clients to determine the best way to deliver whole person care with the Stakeholder 360. It also provides you and your entire team with real-time program insights that you need to share your impact with funding agencies, donors, volunteers, and other community stakeholders. And when things change, and they always do, you'll be able to adapt because you have the power of flexible, integrated systems in place and then you'll be able to make adjustments quickly and efficiently. So let's take a look at how human services, nonprofits like yourself, are using the Stakeholder 360 to build meaningful relationships with clients. Salesforce for Nonprofits allows you to unite all of your data in one place and the ability to integrate with thousands of tools. This solution will help you bring together data from multiple sources to make evidence-driven decisions, collaborate with and empower your clients to reach their goals, build trust and confidence by understanding the needs of every client, and then help shape and improve program impact guided by real-time data. Nonprofit cloud case management helps case managers manage the entire client or guest lifecycle in one single system. You may be doing this using spreadsheets or paper, or a tool that doesn't necessarily help you guide your clients in moving forward toward achieving their goals. With nonprofit cloud case management, you're able to track services, case plan notes, incidents assessments, and outcomes in a single system that's accessible from anywhere. Valerie's going to introduce how Provisio is using their industry expertise to support a seamless digital experience to organizations that are supporting individuals to find and/or stay in safe and reliable housing.
Hi, everyone. I'm Valerie Rogers. I am our Senior Solutions Engineer at Provisio Partners. We are a Salesforce implementation partner. We exclusively work with human service organizations like yourselves. We are a team of about 70 individuals. Many of us come from the nonprofit background and have worked in different agencies that provide housing and homelessness, early childhood, workforce development, and mental health services. We are working with over 160 clients around the country, and we implement Salesforce only for nonprofits and public sector partners. We do provide a variety of services. We do custom implementations where we work with you to determine what your needs are and build upon Salesforce to make sure that you can get what you need out of the system. We also provide cause area solutions. One of them we will show today, which is our housing and shelter solution. We also have built out solutions for early childhood, aging, and also workforce development. We also work with a great data team to provide data analytics through Tableau and set up Tableau dashboards for our clients. And on top of all the great implementation work we do, we also provide managed services to provide ongoing support to our clients. We do work with many nonprofits across the country, including community-based organizations, housing and shelter organizations like we'll be talking about today, developmental disability organizations, ethnic and immigrant centers, also employment and job training organizations. So these are just a few of the clients that we work with across the country, but we do work with many more as well. So I'm going to start by showing you all a demo of our cause area solution for housing and shelter. And then after that, I will pass it on to Colleen. So I'm going to stop sharing my camera right now so I can look at my second screen to do the demo. But we will start by walking through all of our demo information. So now I am logged into Salesforce. You can see that I'm in our great case management app. The case management app has a fantastic homepage that can be set up for your different case managers or additional staff like your leaders and also your managers. You can see on the homepage that we can see some great information like today's events. So if I have any events with clients, I can see them here. We can also set up dashboards so you can see pertinent information all in one place. So for example, here I can see our housing dashboard. I can see the active program enrollments that I might have in different programs. I can see how much rental assistance we've given this year or how much we've given in security deposits. And then I can also see additional information on rental assistance as well. We can set up different dashboards for your programs based on what's needed. So for example, with shelter programs, we can also set up a dashboard on your homepage that shows how many bed assignments that you have open or beds that you have open, any night checks that might have happened, and also your daily census. We can also see from this home page as well that I could set up list views to see information that might be really important to my case managers. So for example, I can see any available beds that we have as we're working to assign people to shelter beds. We can see beds that might have a pending reservation, so we can set up different statuses for those bed assignments. And also, as we're working as case managers, we can also see some of those clients that might need to do a reassessment over time. So with these home pages, we can really set up what is needed for those different staff to make sure that they can get the information that they need. We can also see here that I can see any open tasks. I can see, oh man, I need to meet with Gloria Geekus because it looks like I was supposed to meet with her and her caseworker a couple days ago. And then also I do have a task that's due today. So these home pages are great because it really can provide the information that you need all on one page when you log into the system. The next thing that I'm going to show is how to search for clients. The Nonprofit Case Management app has this fantastic client search that allows you to search for only clients. We know Salesforce is also used as a Rolodex for your businesses and different organizations that you work with. So this will allow you to be able to search just for clients based on things like first name, last name, legal name, client ID, or birthday. So you can see here that I just searched for our client, Sonia Hunter. And once I click on that client search, I can easily pull up her information and then collapse that. Salesforce also allows you to search up here via the global search bar. So I can also search for Sonia here, and then we can see any related information that's tied to Sonia as well. Once on the client contact, we can see some really great information about the clients that we're serving. We can see Sonia's full name, her birth date, her age as we're working with her. You can also upload a photo if that's helpful, especially if you're working in a shelter program, to be able to see the guests that you're working with, as well as be able to see any critical client alerts for that client. Are they allergic to peanut butter? Or do they not like loud noises? What are their triggers as you're working with them? We can also see from these contact pages too that they can be set up to track some really important information all in one screen. Here we can see that we can see basic information, her demographics, any contact information, as well as her emergency contact. As we're looking at Salesforce, anything in Salesforce can be customizable. So as you're looking at this, any of these fields can be changed. We can add additional fields, so it can really be tailored to the needs of your organization. We can also go in here and see any related information, any family members, any intakes we've done with her in the past, and any incoming referrals, as well as any programs she might be in, any assessments we've done in the past, any case plans, or any services that we've provided. In this case, we're going to pretend that Sonia has walked in as an internal referral coming from another agency. So here we can show that she's coming in, she's interested in our shelter program. We can track where that case came from. Let's say this one came from phone. We can track who referred her. So in this case, she was referred by Pathways Church and a contact at Pathways Church that we're working with, Claire Dunphy. And we can track any information about what she's looking to receive as services. So we can track a description here that she's recently homeless and needs a place to stay. These incoming cases will allow you to track how you're working with outside agencies as they're referring clients to you, as well as start to track how you're serving those people. So here we could say we're starting to work on this case and see any of that pertinent information as that comes in. We're also able to, from here, to also create an intake. So in the intake process, we're able to see what information we might need to collect with that client as we're working with them through the process of receiving services. On that intake, we can see where that inbound referral came from. We can see that's coming from a local church. We can track any income details if that's relevant. We can also see on this intake page a lot of that contact information. So if we need to update anything or create a client ID for that client, we can easily do that. We can also see any family members, upload any files, or also do assessments as part of that intake process. So in here, we can come in here and do a self-sufficiency matrix to see how she's doing with everything around her housing situation. We can track the date that that assessment completed, and then we can track how she's doing across the board. So in housing, she's in crisis. In employment, she's vulnerable. food. It seems like she's safe. And then you can kind of track a lot of these different assessments that might be helpful as you're working with that person through that intake process. We often see the self-sufficiency matrix as one of them, so that as you're working with that client, you're able to kind of see how they come in versus when they leave your program, how they've grown. Another great feature of the intake process are these intake checklists. So you can see here that we can create intake checklists based on the different programs that someone's in. And then these intake checklists will also create tasks for your staff automatically. So with these intake checklists, once this is selected, it will show you all the things that you might need to collect for that program as part of the intake. So we can track that we've just completed our intake assessment. We can make sure we collected and updated that demographic information, collected emergency contact, and then also tracking any of that eligibility information and program enrollment information. Let's say Sonia is a great fit for our program and we want to make sure she has a bed to sleep in tonight. So we can easily come in here to create a new program enrollment directly from that intake. We can search for our program in here. We have our shelter program. You can see any of those programs I've most recently used are showing up at the top. If she's part of a cohort, you can track that as well. We can track that she's one of our clients, that she's active in the program, and then put in a start date. So now we're able to show that she's actively engaged in our shelter program. These are some of the features with the NCCM app that you can see that come out of the box, including tracking those home pages, those clients, the cases, and also the intakes as well. And then we've also created a lot of different assessments for different programs based on what is needed for the programs. What I do want to show you now is how we will assign Sonia a bed. So we have worked to create a bed mapping solution, actually with one of our fantastic clients who's on the phone today, Colleen, so that organizations like yours that are working in shelter programs or transitional housing programs where you need to know where someone is located physically are able to do that easily. So you can see I've just gone into our bed mapping app. We're able to look at a bed layout. So I'm going to search for one of our accounts so that we could find a bed or a room. And you can see now that we've selected that room, you can see a physical representation of the rooms that you might be working with so that you can easily assign or unassign beds. So as you can see here, we do have some beds assigned already. Anything that's gray is showing a bed that's already in there. And then we're also able to easily select beds and drop them onto the page layout. This is really great as you're working with bed management because as we know with COVID, often beds have to move around or you might have to space beds out differently because of COVID restrictions. You're also able to easily come in here and adjust the height of the bed or the width of the bed. So if you're doing vertical beds, you're also able to do that as well. One of the other features that's really great about this is that when you're working with bed mapping, you can easily place the beds where they need to be. And then when you're assigning the beds, you can also make sure that you're assigning beds in a way that works best for your guests. So with the bed layout assignment, what we can do is it's an easy way just to upload a photo of your location or those rooms so that you can easily drop beds into the locations that they need to be in. If you don't have physical representations of those rooms, we can also still do the bed assignments. There just won't be a photo behind those or a layout behind those. So there are ways to kind of set this up, even if you don't have the physical representation of the rooms. In addition to those bed layout assignments, we can also see our room layout set up here. So here we can also see in here, oh, my apologies, I'm showing the same screen again. We can also show the different rooms and show how many beds we have in them, how many of those beds are available, any age ranges. So as you're working in different shelter programs, maybe you have different gender assignments or age ranges that you're working with, so that as you're assigning those beds, you'll only see the beds that are tied to those specific guests so that you're assigning them to a bed that makes sense for them. We can also see from this room here that we do have 34 beds and that 9 of those are occupied. So as you're assigning people beds for the day, you can easily see how many that you have available. We can also drill down specifically on those beds as well to see any additional bed information. So here we're easily able to see what shelter they're tied to if you have multiple different buildings, what type of bed that is. So if you're assigning people to different types of beds, like a lower bunk, an upper bunk, a twin, a queen, a rollaway, all those different types can be tracked. You can track the specific gender that you're targeting for those beds if you need to separate out by gender. And then also track things like the bed status. So is it occupied? Is it available? Is it on hold? Tracking all those different things that might be important as you're working to assign those beds to your clients. So how this works when we go back to our NCCM app is that we can see Sonia here, but we can also easily create a bed assignment for her. So let me go into Sonia's contact. And then from her contact, we can easily create a bed assignment. So here we can select the room we want to work with. We're going to select room 100. And then here you're able to see all the people that might be in that room already that are highlighted in red. And then anybody that where that room bed is still available will be highlighted in green. This is great for a couple different reasons, many of which we learned from our fantastic partners, Water Street Mission, is that as you're assigning beds, you can make sure that you're assigning someone to a bed that makes sense for them. You might have people that don't sleep very well at night, so they might need to be by the insomnia room, or you can also see where other people are located. So if they have good relationships or maybe not a great relationship with somebody else in the room, you're easily able to assign someone to a bed that makes sense for them and assign a start date. So in this example, I actually already have an active bed assignment for this guest. So I'm going to select a different guest in here so that we can easily create a bed assignment for her. So when we talk about these bed assignments too, you're able to select the bed, the start date, and assign that bed. It looks like I'm running into an error right now, but what will happen is if this works successfully, and I did just test it this morning, you should be able to assign a bed to someone. And then what we will do is once you've assigned that bed, it will turn that bed red and assign them to that specific bed. So with the bed assignments as well, it's important to note too that we can set it up so that as you're thinking about those visuals, we know often sometimes people might need to plug in their phone or have a CPAP machine, but you can also see on these bed assignments where those different plugs are located so that as you're setting people up for their medical needs, you're also able to do that as well. So as we assign these people, you're also able to see where they're located, and once they're in those beds, it will turn red. In addition to the bed assignments that we've done as well with other organizations, we have built out the ability to scan into those beds at night. So as you're working with those guests, once they come into the building, we have generated barcode scanning tabs for people so that they can come in with their guest pass, they can scan in for the night, and then you know that they were in the building for the night and that they were in their bed. So that's really great as well for shelter programs as we're thinking about those different census reports that you have to do, both from a reporting standpoint, but then also from a physical safety standpoint, as you might be doing, if you ever have a fire drill, knowing who's physically in the building, being able to do that as well. In addition to the shelter programs we work with, we do work with a lot of different other organizations as well that provide housing, including groups that provide transitional housing, rapid rehousing, and other services as well. So as we're thinking about not just that bed mapping piece or where people are physically located in a unit, a rental unit, or a specific building, there's also ways that NCCM can provide you a way to show how you're serving those clients. So there's this great tab at the top of the application here called bulk service deliveries. I really like this because as a case manager, as you're thinking about the work that you're doing, you might just want to put a lot of information in at the end of the day to make sure that as you're working with the different individuals you're working with, you can easily put in information on the ways that you're serving them and do it quickly. So here we could either create services for a group or also create services for an individual. So in here, I'm easily able to come in here, search for Sonia, find her shelter program engagement, and then look at the different services that I'm providing. So here we can say that we've had a case manager meeting. We worked on that for 30 minutes today. And then we're also able to add in additional information about how we're working with Sonia and track additional services that we might be providing. So maybe she's also working on going to school. So today we provided a backpack. And then also we went in and we provided as well a job coaching session because she's working to get on her feet and make sure that as she moves into transitional housing, she's working on getting a job. One of my favorite features of the case management app that you can see here is that we can create those services based on different measurements. So this is a great way across the board to be able to easily see how you can provide services, but then also count them in the way that you need, so that when you get to the end of the year and you're doing all of your service counts, it's all in one object, it's easy to report on, and it's easy to show your impact. So as we can see here, I'm easily able to create those service deliveries. One other feature I wanted to show as well is not only can you create those service deliveries from that bulk service delivery object and search for different clients, we can also create client notes easily here as well. So as we're working with those clients, we can easily collect information on them. We could say, Sonia came in today to do an intake and was assigned a bed. We can track it tied to that client, that program engagement, the interaction date, for example, and all of these fields can be customized as well. And also the type of interaction. We know often with COVID now, it's a lot of phone calls or emails, so being able to track that too. And then here we're able to track any notes. So like Sonia recently lost her job. She is in need of housing. These client notes are great too, because they, as you can see, they save as they go. You can also make them rich text, and you can also put in tags here so that if you want to search for things later, we can assign tags. And you can also relate these notes easily to service deliveries as well, or related records. So as you're doing your client notes and want to create service deliveries, because maybe during this conversation you gave her the backpack, or you also worked on the job coaching, you can easily do that all in one place. So what does it look like once you have all your fantastic information in Salesforce and you're tracking all that work? You're able to pull all of that information into dashboards. So you can see here that I can click on dashboards. We can see a lot of different dashboards that I have on here. For example, our housing dashboard. And with these dashboards, these can be customized based on your needs. We can customize how these look. These can also be adjusted based on different sizes. But you can easily come in here, refresh, and we can see information on how we're serving our clients over time. So often when we set these up, we can set these up at different levels as well, both from the staff level to the management level to the executive level, because as we know, your different staff levels might need to see different information that's pertinent to their job. So often with staff, we might see that they're tracking, you know, their specific clients, what assessments they might have coming up, who's assigned to what bed, or who we're providing rental assistance to. We can also see as well that you can track on the management level, like who your different staff are, how many people have open tasks, what people's caseloads look like as well. And then from a management and executive standpoint, what does your overall impact look like? How many services have you provided this year? What was your goal? What are the demographics of the clients that you're serving? Are they coming from a specific area of town? Are they coming from a certain federal poverty background or income level? So that as you're serving those clients and advocate for your needs, you're able to do that with all the information that you have in Salesforce. Just to show you as well, any of these reports you're able to click into and able to edit as well pretty seamlessly. So we can easily click in here, we can see any information that we might need to see, and then we can also go in here and edit and easily add additional fields. So from a reporting standpoint, this really makes it easy to drag and drop in additional fields that you might need. You can see I can just double click on fields and it's going to add the client. You can track the delivery date, for example, and it's easy to update all of that information very quickly. So those are just some of the things that the NCCN app can provide from a base level. So as we did talk about, it's those home pages, the clients, those incoming referrals, those intakes, and those program engagements, as well as the client notes and those service deliveries. What we at Provisio have built on top of that is the ability to track the bed mapping, assign people to beds, allow people to scan into those beds at night, as well as track any other services that you might be providing to those clients if you aren't a shelter program, like rapid rehousing, veterans housing, transitional housing if you're tracking leases and buildings and units. But these are just some flavors of the different clients we've worked with and the things that we've built out in this cause area solution. So I'm going to pass it back to Steph, who's going to bring up our PowerPoint, and then we will introduce Colleen. So I did want to introduce Colleen. I am so lucky to have gotten to work with Colleen over the last 2 years. She's one of our fantastic clients. She works for an organization called Water Street Mission. They've been a project I've been working with over the last 2 years, and they're just a fantastic organization that does great work. So welcome to the call, Colleen, and we're excited to hear a little bit more about Water Street Mission.
Yeah, thank you so much. So Water Street Mission is started out as more of a community-based organization back in 1905, handing out food on the streets and just working with people on the street. And then eventually we moved into shelter space for men, and over time evolved into shelter space for women with children, and for men. And so we have shelter programs, we have separate shelter programs for families, and we also have robust residential ministries for people who really want to get help, get to the root of what has caused them to become homeless. In addition, we do a variety of community outreaches. So we do have a food bank. We feed probably 600 families a week through that. We have robust medical, dental, and behavioral health clinics that not only serve our clients internally, but serve the community around us. And we do pre-K kindergarten education and some community-based teen and young adult programs, which includes a big recreation facility where we host a bunch of things for them. So to talk a little bit about why we engage Provisio, we had a custom built system that we had some developers that volunteer their time to help build a system for us about 13 years ago. And one of the developers stayed on as a staff member. And so he kind of was our data management guru. Unfortunately, as the product was being completed, it was not fully web-based. So it was kind of half web-based, half not. It wasn't mobile. And so it had some limitations, but I took over the mission 10 years ago and completely revamped all the programs. So our program structure for all programs changed considerably. And so the data management system was not what we were going to need to take us into the future. And we looked at some of the packaged software that other groups were using, and it just didn't have the flexibility that we needed. And so I always believed Salesforce was going to be the best option for us. And we were at a place from a capacity standpoint to actually be able to work through that process. And I had 5 goals, 4 specifically that we've rolled out already. And that was, we really struggle with communication because we didn't have the communication tools in the old system. So we had resorted to just kabillions of emails everywhere. And some emails would get lost. If you were in a particular functional area, but you only work part-time, you would have to dig through all these emails to try to understand what was going on with clients. And so it was very, very inefficient. And we had a lot of drop balls as a result of that. So for staff usage, but even more so that our guests got served in an efficient way, and a dependable way, that was a huge challenge for us. We also needed real-time action planning and accountability. So we are a strength-based, individually based program. So we don't have something that people start and 12 months later, they're done. We have 8 core areas that we believe are the root leverages to poverty. And so we work within those areas to create an individualized action plan based on what each individual needs. And so our ability to see somebody actually was in class today, or they were not in class today, or, you know, they met with their mental health counselor, all of that data became really important to us to be able in real time, you know, to work through that with our guests. We also had brought in a lot of evidence-based practices and needed assessments that would be able to track mostly outcomes. So we could see what was working and using those assessments almost in a way paired with customer satisfaction surveys and things to see how people were progressing, if there were stuck points. And then the final thing was a guest portal. A lot of our guests are finding really struggle with executive functioning due to serious mental illness, addictions, traumatic brain injury, age. And so we spend a lot of time helping them, you know, write out little cards that they keep with them all the time. And we really wanted to bring them into the digital age because they all, you know, could get the free cell phones. And then during COVID, that expanded that they could get tablets. And so just teaching them to use some of those functions and linking that so we didn't have to duplicate information. We decided to create a guest portal and get the guests actually to be able to use the system. We have not fully rolled that out yet, but we do have that developed and we'll be looking at next steps. The final thing not on here was just a robust learning management system. We found during COVID, and actually we started the build out during COVID. We had selected Provisio through an RFP process before COVID, and then COVID hit, but we decided to go ahead and still move forward with the planning. But that piece is just some things we learned that, you know, needing to do virtual teaching and some other things to meet guest needs. We wanted a place to actually store digital information for guests, again, to be able to access that later on. And even for alumni to come back and, you know, learn certain lessons that they had been educated on. And so that was really the impetus of what drove us to look for a solution and realize that we needed something customizable, I'm sorry. And the reason we chose Provisio partly is because I was in the consulting world for 18 years, specifically focused on the human service and industry and healthcare industry. And so we did do a lot of work with IT vendors. We helped people with software selection, and then we helped with implementation. And so innately, there were some things I really needed in a partner because I saw many failed implementations, and failed implementations cost you so much. But the biggest thing is that they cost you the morale of the staff. When they have a failed start, they don't have the confidence to do another new program. And so it was really important that we had a highly relational partner that was very committed to understanding ways that we did things that were pretty unique and probably highly visionary, hadn't been tried at times. And so as we met with vendors, people were pretty fixed in what they wanted to do for us or their assumptions about what they would deliver because of what they had delivered to other clients. And what was interesting with Provisio was they really wanted to understand, and just like Val has been with us since the beginning of the project, but our initial project team were almost like family to us because they were so excited for our organization to be better. It was like they were cheerleaders. We still think Val is like part of our staff. And then we remember that now she works for another organization. But I think the relational capacity and just the willingness to hear and understand and kind of get us on the same page, talk the same language, was things that we really saw in the RFP, the responses to the RFP that made Provisio the partner for us. So I think that's probably plenty for general information. Val, unless you have anything you want me to answer before we go to questions from the audience.
I think that's a great background.
Excellent. We do have one question from Jose, and Val, I think you're probably going to talk to this one about how guests are scanning in. Are they using a scanner or a mobile app? Can you talk to that a little bit?
Yeah, so the way that we've built this out is twofold. It depends on the agency. For Water Street, what we've done is the staff or guests that are scanning people into different events or beds have a phone. And what they can do is they can pull up the specific service. And what they'll do is they'll actually scan the barcode with their phone. And then when it pulls up the barcode, it will pull up that client's ID or guest ID and then check them in for the night. Water Street is also using this in other ways. They're using this to scan in for meals. They'll eventually use it to scan in for events and classes. So that is specifically with their organization, people have to be at a class for a certain amount of time to be considered attended. So we can also use those check-in and check-out times to be able to determine people's participation with the event. We also have set it up where you can do scanners. We work with another agency that actually has a physical scanner. So we have tested that a lot where they can plug in those scanners into their Salesforce, and then they can also use those scanners to scan those barcodes. The barcodes and those pages can also be set up based on the needs. So like, for example, for Water Street, they wanted their logo, they wanted a very specific photo size on there, and also the client ID as well.
Yeah, and we are actually using some of the scanners, like for mealtime, they scan in on a scanner, not a phone. And I actually think that we're going to set up the classes with the scanners in and out versus using the phone. So we can use either. And, our guests are actually used to scanning because we don't have heavy security. You don't have to have your bag searched or anything like that. But we have really used technology as a way to limit certain guest areas and actually to track where people are. And so we are heavily cameraed, and most of our doors have the scanning ability to, already. And so it was a natural movement for us to move everything else into this environment the same way.
I think it's important to note that there's other things you can build into that scanning. So especially with shelter groups, if you have people that should not be on campus, you can also build out that if someone's scanning in and they shouldn't be there, that it flags that, which is really helpful too, because especially as you're thinking about people that might have been asked to leave campus for different reasons, there's different ways that we can set up that security when you're scanning in to be able to easily see if that person should not be on for any security reasons. So I know Jose asked a second question on if this is a purchase package or a build out. This is something that we have built out. So one of the benefits of working with different shelter groups and transitional housing groups is we have worked with our clients over time to build out some of these functionalities. And because of that, we're able to easily drop them into different orgs. So we've built out the barcode scanning, we've built out the way to create badges, as well as the bed mapping. Those are things with organizations like Water Street and some of our other clients that we've been able to build these things out so that they can easily be leveraged for other groups, so that you're not really starting from square one. We have that solution, we can drop it in and then we can configure it to your needs, which definitely saves a lot of time and money as well.
Excellent, thank you. So we have a question here for Colleen. Can you talk to us about the types of information Water Street specifically was looking to track?
So I really wanted us to be able to look at leading indicators instead of lagging indicators. So number of services are already always important, but it's retrospective and it doesn't kind of trend for you what could come. And so even, the ability for us to connect assessments and report out, if people are taking, retaking a 30-day assessment, to quickly go in and know we need to do a plan change or some kind of intervention, or, our experience is teaching us that this person is not going to make it. When we've added positions, so part of the new model was to be very trauma informed, both in building design, but also in programming. And so we have found that 3 safe people, what we call safe people, we have a definition for that, meeting somebody at the door and being in relationship with them is a really important thing for them to actually be able to feel safe and address trauma. And so we had a case manager, life coach that always met people from the door, but we added a 3rd position called liaison, so that we had a really intense, kind of orientation relationship with everybody that came through our door in the first 7 days. We were losing people, about 30% of our guests at like day 2 to day 3. And, I had talked about, I want to add these 2 positions specifically aimed at moving people to the 7-day mark. And so we needed to track, were people staying longer? We needed that, in real time. There are times we're just overwhelmed with admissions right now for single individuals. And, this time of year is not that busy for us. It's usually busier for families. So the ability to pull up the data from the day from the intakes, go, where in the world did they come from? Is it out of county? Is it out of state? Is it a particular, we had a lot of transition houses for drug and alcohol show up in our community. And we just started to see, a lot of dumps from them where people were not kind of doing what they were supposed to do. So it gave us out of county and out of state people. So we were really looking for real-time information to make decisions. The other thing, we are completely donor funded, but we have some pretty sophisticated donors who want to understand our efficacy. And so being able to show people, for example, we have a step up program, which is career learning, finances, to see that that's working. We had a very large grant that was given to us, but it needed to really show that at the end of the time, we had, 50% of the individuals we were serving had elevated themselves out of poverty, or at least decreased the societal cost of, kind of impact, because before step up, they might've been on disability, they're homeless, their children were taken away with the state, they were in trouble with the law all the time. And tracking through the step up program, we would look back, 5 years. It's always our goal to be able to see the 5-year history of incarceration, involvement with police, involvement with children and youth, ability to work or not, and really create a value proposition as to what that particular program was doing. And I think we look at a lot of our programs in that same way, like what are the things we're trying to accomplish at the individual level, that is not just like tracking the amount of services that we gave. Is that answer the question?
Yeah, that's great. And actually one related question came in. Has your development and fundraising team benefited from getting your program on Salesforce? You kind of touched on that your donors who are a little more advanced are looking for those metrics, but is there any other way that your fundraising team has benefited from the Salesforce solution?
We haven't been rolled out all the specific parts yet. We've rolled out a lot. We're still problem solving some things. So we don't really, I actually sat with a major gift officer yesterday who was like, Colleen, I'm going to come to you because you're going to give me all this data. And I started to laugh. I'm like, I can tell you for this grant that you got from from one of our friends that here's what we've seen movement on, but I can't guarantee that we're going to hit the 1 year out metric because, we haven't been collecting data on a lot of that. But our development department is just thrilled that they're going to be able to report out things, especially we did report out on the Step Up program, our first pilot, and the first 10 people we put through the pilot. And when we were able to show, where people were now versus when they entered, I think our average savings to society, so it was kind of work minus societal costs, the average was about $250,000. And so when you see what dealing with the whole person in all areas and long-term stability, it does look different. So we have a poverty coalition that's really trying to improve workforce compliance and salaries. And that gets you so far. But when you tackle a whole bunch of these issues together, I think people were really, really shocked, which we knew was going to be true. But when we put the data to it, so you can tell a pretty compelling story. With our major donors, they have an opportunity every 3 months to have meetings with our leadership team, and we do talk about different things, and this question of data and outcomes always comes up. And so at least now we can speak to what we've built into the system and what we are anticipating, down the road of how we'll report that out. But yeah, I think it's huge for development, for your marketing team to have that kind of information.
That's great. The connection between numbers and storytelling, we know can really be compelling, and $250,000. That's incredible. So the last question is, do your guests feel a difference? Do the folks who you serve every day, can they tell that you've made a change in a positive way by going through the Salesforce implementation?
I think depending on who the guest is, the intake process up front is much smoother. So we do just a mini intake up front. And then 7 days later, we get the detailed, because from a trauma perspective, we don't believe we have any business asking them the real personal hard questions, which if anybody's using HMIS system, we do not provide everything into it until day 7. And so we also don't take HUD money, but our data is used in the community to fund, many services. And so we just needed to explain this is not in line with our philosophy. But doing that as just a part of a case manager sitting down, understanding the story and adding a few details versus we used to give a paper file out, people would have to fill it out, give it back to us, and then they would do an interview. That felt a lot different for our guests versus coming in, and just really paying attention to how they were feeling and that kind of thing. So I would say on the front end, we have noticed the difference with those things. Our guests are very, very excited for the learning management system and the portal. They don't really understand what all they're getting, but they just are really excited that they're going to get some of the tools, and that, we follow our guests for 2 to 5 years. With every program element we have, we can follow them into the community. The one piece we haven't had is they'll say, when I took this class, I learned this. I so wish I could see that again. And there's certain tools we've developed that we walk with them through that we can now demo and put in the learning management system. And I think we have heard from alumni and even from current guests in transition that they really, really look forward to being able to have that kind of access that will help sustain the restoration.
And I think one of the great things with the portal with Water Street too, that we're working on building right now, is for them to be able to see their service plans. So I think, and we often see this in case management, is when you create that great case plan or service plan and somebody walks out the door with it, sometimes that paper gets lost and people don't know what they have to do. So with the portal, especially for Water Street, it's going to surface up the classes they have that day, the different meetings they have that day, eventually be able to, work with their case manager and life coach if they need to be able to cancel things or readjust things. So it's going to be a great visual way for them to see how their time is structured at Water Street.
And even for us to cancel something, I mean, we still have weird COVID stuff going around. So if a teacher calls off and there's no one to replace them, a lot of times guests have to come to the classroom and there's a sign on the door, where this way, if somebody cancels, we will take that class roster and text everyone, you know, that there's not going to be class for the day. So I think there's some real conveniences that they will gain that way.
That's incredible. I can't wait to hear more about that. We have a couple more minutes, and Val wants to show something that was missed during the demo. So Val, I'm going to stop sharing my screen so you can share.
And we did two more questions that came in, so I can answer those as we're walking through things. So if you can see my screen now, I just wanted to show you how that bed mapping works. Unfortunately, I just ran into a quick error, so I was testing it while I wasn't sharing my screen. But you can see here, we've got a new contact, Madeline. We can create a bed assignment for her. So we did show you those bed assignments from a visual perspective, but if you do have those bed rooms that you don't actually physically have the room, you can also see that you can still select those rooms and assign someone to that bed. So here we quickly created that bed. And now that you see that Madeline's on it, you can see where those beds are available. So if we went back to other rooms, you can still see what rooms are available. If we go back to that room, we'll now see that Madeline is assigned. So I just wanted to show that to you all because that was something that wasn't working a couple of minutes ago in the demo and wanted to clear that up. I know we did have 2 additional questions. One of those was regarding the portal. For the portal, we are using Experience Cloud for Water Street Mission. We've worked with other clients as well. We're often using Experience Cloud for that as well. There's 2 different versions though, depending on how you're working with your clients. In the example of Water Street, they're using Experience Cloud with what we call an authenticated portal. So all of their guests will have a login, and then their logins will be what the guests will use to be able to see the portal. We can also set it up if you are doing just a basic intake where it's unauthenticated, where people don't physically have to have a login as well. So Experience Cloud is great too as you're working with your different guests and clients, because not only can you surface those service plans, you can even have guests or clients be able to update their contact information, their family members. We see groups using it as well to connect with their case managers. So there's a lot of great use cases for that Experience Cloud. The other question that we got was, is Water Street using volunteers for Salesforce as well? We did implement it from a phased approach. They are not using it yet, but it is in volunteer. They do have it in Salesforce. Some parts of their program probably will still stay in other systems, but I see some of the benefits for volunteers for Salesforce in agencies like this is being able to connect some of those programmatic places where you need volunteers. So for example, serving food in the lunchroom, working in the children's center to have volunteers that are going to be working with the kids, even those events that you might be doing. So Water Street holds some really fantastic events during the summer, and being able to find volunteers for those events can be really great as well. So the great thing is we can really tie in volunteers to Salesforce into the program side, to make sure that as you're working from both the programmatic side, but then also finding those outside people to help as well, that can be a pretty seamless process. So we can even tie volunteers to those different service deliveries. We could tie it to specific work that they might be doing. And also even with volunteers, being able to provide them potentially with a portal, if you're working with a big volunteer contingency, where they could even put in notes on service deliveries if you're working a lot with volunteers.
Awesome. So as we are just up against time, we want to thank everyone for joining us today. And we hope that we see you at our next session next Wednesday on childcare. Feel free to invite other community members and your colleagues. Again, I want to thank Colleen for joining us this morning, a true trailblazer. We are so pleased that you were able to share, and we look forward to continued partnership and all of the impact and successes that are going to come out of the Water Street mission. Thank you to Provisio for supporting our demo and our technical questions this morning. And if you have any questions, feel free to connect with us, and we will talk to you all soon. Have a super day, everybody.
You too.
Bye-bye.